Good afternoon, sir.
Put off your mic.
As you're coming in this lecture, off your mics, mute your mics. Awashima don't do.
So I will do that immediately. Sorry.
Welcome back from the break.
Okay, sir. Thank you very much.
Okay, we were about to take a question before we went on break. Yes, can we take the question?
Seems the person has not joined.
Okay,
Maybe
you have forgotten that break is over.
maybe having hitches.
Okay,
Washimadondo,
let's
you say
continue
immediately and
because
you are not off to
we
your
have
mic.
much to do. When she's back, we can take her question. So before we proceeded on break, we were looking at causes and contributing factors to psychopathology or to psychosis. We had said that causes and contributing factors can be looked at using the biopsychosocial model. It's an integrative model that has to do with biological factors, the contribution of biological factors such as viruses, bacteria, fungi, and protozoa. And we also have to look at the psychological factors that has to do with our psychic, has to do with the way we relate with others. We have looked at child abuse, stress, trauma. We also looked at environmental factors, and these factors have to do with our social relationship. It has to do with our social interaction within the environment. We spoke of alcohol, we spoke of drug abuse, spoke of stress, and we also looked at the Nigerian factor. We spoke of inability to access good and quality healthcare, spoke about poverty, and then our belief system, how they contribute to the onset of psychosis. One question one will be asking is, are psychotic disorders treatable? Yes, psychotic disorders are treatable, but they are also not curable. Once an individual develops psychosis, it is a lifelong mental illness. However, he can be managed to function optimally. And there are there are DSM classifications to treatment of psychosis. And these treatment approaches, are we together, please?
A lot of them have not muted their mics.
Yes, sir, we are hearing you, sir.
Oh, then you can unmute yourself. I've muted them all, so you can unmute yourself now.
Okay, so there are treatment approaches to psychosis. Remember, I have said psychosis can be treated, but it's not curable. So individuals who develop psychosis as a mental disorder are going to live with this mental disorder the rest of their lives. However, they can be managed to function optimally. And one way of treatment is the pharmacological treatment approach. This pharmacological or pharmacological treatment approach has to do with the use of drugs in treating psychosis. And these drugs are called antipsychotics. Antipsychotics because they are working against the psychotic features. So they are against those symptoms of psychosis. So when individuals are placed on antipsychotics, it reduces or minimizes the presence of these symptoms that shows that an individual has mental illnesses. It reduces the hallucinations, the thought distortion, the psychomotor distortion, the speech distortion, the mood distortion. They work to minimize the influence of these variables on or symptoms on the life of the individual. One common antipsychotic we can talk about is risperidone, which is called haloperidol. It is a common drug that is used in the treatment of individuals that have come down with psychosis. There are several others like Adderall. There are, depending on the type of your psychotic disorder. There is no one drug that treats all psychotic disorders because their symptoms varies from one to another. And these symptoms are managed based on different classes of antipsychotics as it relates also to your presentation and your type. Remember when we had looked at those types, there are treatments that requires what we call eclectic therapeutic pharmacological treatment approach. It requires the combination of antipsychotics with mood inhibitors to treat a particular disorder. Remember, we saw bipolar disorder. We say that individuals with bipolar disorders come down with antipsychotic features, and they also come down with mood disorder features. Such disorders require a combination of therapeutic approach to take care of the psychotic symptoms and the mood symptoms that are present in presentation. Now, beyond drug treatment, there is also what we call psychotherapeutic treatment. Psychotherapy is derived from, psychotherapy has to do with the treatment of the mind. If you divide the word psychotherapy, you will have psycho and you have therapy. Now, psycho has to do with the mind and therapy has to do with treatment. And when you combine this word psychotherapy, it entails treatment of the mind. Now, you remember when we mentioned schizophrenia, one common symptom or characteristic feature of schizophrenics is the fact that they have lost touch with reality. Their thought process is disorganized. Their thinking is not coherent. So what psychotherapy does is it talks to an individual. It has to do with talking to an individual who is receiving pharmacological treatment in order to restructure his own thought process and be reintegrated properly into the society. There are different forms of psychotherapeutic treatments that can be given to psychotic individuals or neurotic individuals. But this is also dependent on the type of psychotic disorder presented or the type of neurotic disorder the individual suffers. But commonly, we have what we call CBT, the cognitive behavioral therapy. Remember, when you talk about cognitive behavioral therapy, we're talking about cognition. Cognition has to do with your thought process. Once there is a thought process, the thought process is presented physically in our behavioral manifestations. I have thought to slap someone. But when I see him, I stretch forth my hand to slap him. That's a behavioral act. So cognitive behavioral therapy is a treatment of the mind that is made manifest through actions. That is, an individual who receives this treatment, you will also begin to notice his behavioral manifestation and presentations being improved upon. So we have cognitive behavioral therapy as like a therapeutic treatment. We also have family therapy. Family therapy has to do with the whole family being treated. Now, individuals with psychotic features also suffer stigmatization from family members. Now, if they are integrated back into the society, they are going to first receive the first form of acceptance from their family members. So family therapy is one of the therapeutic approaches used in the treatment of psychosis. And then we also have what is called supportive therapy. Supportive therapy is very important. It has to do with supporting the individual to be properly reintegrated into the society socially, occupationally, family-wise, etc., etc. Now, supportive therapy is based on the basic principles that individuals who are supported either by family members, fellow workers or co-workers, and who are also supported by friends tend to have a better form of integration into the society than others. And this form of supportive therapy can come in 3 different ways, whether it is coming from friends, it's coming from co-workers, it is coming from family members. It can come in the form of emotional support, supporting the individual emotionally, having empathy, stepping into the individual's shoes in order to give support and to help him be strong and, functional in the society. It can come in form of informative social support. It has also come in form of tangible social support, which has to do with giving the individual tangible helps. It could be food, it could be money, it could be resources that can help him function optimally in the society. And then lastly, we have what is called the community mental health approach as a treatment approach. This approach has to do with issues of awareness. Now, there are federal neuropsychiatric hospitals that exist in Nigeria, and they ought to also serve as our community outreach programs or carry out community outreach programs. These community outreach programs as a form of treatment is a preventive approach of treatment, where individuals become aware of stressors within their environment and see how they can manage and also mitigate these stressors to reduce the incidences or the prevalence rates of psychosis within our communities. Are we together?
Yes, sir.
Is there any question on that?
Yeah, sorry, I came in a bit late, so I didn't get the difference between the psychopharmacology and psychotherapy. Sorry.
Okay, psychopharmacology has to do with drug treatment. Psychotic individuals require drug treatments depending on the severity and also depending on the type of their disorder. Now, there are different classes of antipsychotics, but depending on the presentation of the symptoms presented by the individual, they can be administered. But also beyond pharmacological treatment, mild forms of mental disorders are treated using psychotherapy. Also, individuals who undergo pharmacological treatment also require psychotherapeutic treatment because it is called talking cure or talk cure. The individual is talked with, the mind is talked with, so that there can be obvious behavioral changes that can enable the individual function optimally. And while we have different pharmacological or antipsychotics like risperidone, we have haloperidol, we have Aten. They are all different forms of antipsychotics that are used in the treatment of psychosis. But one of them cannot treat all psychosis because it is dependent on the symptoms presented by the individual. Beyond that, we also say that there can be also the use of eclectic approach in pharmacological treatment. That is a combination of antipsychotics to treat symptoms that are presented by the individual. An individual with bipolar disorder cannot just be treated with one form of antipsychotics, maybe Hadron. There will be a combination of antipsychotics, because there is the presence of mood symptoms, and these two symptoms can be treated using different antipsychotics, but they can be combined together to ensure that the individual is well and is also okay. And therapeutic treatment has to do with talking with the individual to help him overcome his distress. And there are different forms of psychotherapy. We have a cognitive behavioral therapy. We have family therapy. We have supportive therapy. We have the rational, emotive, and behavioral therapy. We have also what is called the existential form therapy. You have the humanistic therapeutic approaches. All these therapeutic approaches are based on certain schools of thought, and they address specific symptoms as presented by the individual. But over and above all, they are aimed at helping the individual have a proper reintegration back into the society. Have I responded to your question?
Yes, sir. Thank you very much.
You're welcome. So in conclusion, we are saying that understanding support and destigmatization helps individuals have a positive mental health. And we're saying that neurosis as a form of mental health involves distresses that preserves our reality. We don't lose touch with reality when we talk about neurosis. Why for psychosis, an individual lost or loses touch with his own reality. Early intervention is crucial for better outcomes of prognosis for both categories of mental disorders. So we are advocating for holistic care, combined medications to support to help those individuals be integrated properly into the society. Nigeria as a nation, we are saying that urgently needs increased public awareness and reduce stigma. Today, your awareness about mental illness has increased by taking a course in psychopathology. It will also help reduce beliefs and the stigma that you once heard against people with mental illnesses. And we're saying that expanded access to mental health services are very, very key in reducing the incidences of mental illnesses, particular neuropsychosis and neurosis. Is there any question?
Yes, sir.
You read your lecture, only that your slide is very thin. Otherwise, we would have been flowing alongside your and your explanation. That would have been an added advantage. But so far, no problem.
Yes.
So you can zoom it from your end now.
The slides are also going to be shared with you. I think it's peculiar with these slides to share with you, and you can also you can have a better understanding of these slides. However, if there are issues,
hello, sir.
Yes.
Sir, I want to ask a question.
Yes, go ahead.
When you were talking about factors of psychosis, the biological factor, that is the genetics, the one that you inherit from your parents.
Yes.
If a child is having those kind of traits, is there any solution to it?
Yes, that's the treatment. That's what we have just discussed, treatment of psychosis. Now,
okay, if if it's inherited too, it can be treated that is psychopharmacy.
It can be treated with psychopharmacology. Drugs take care of symptoms presented from mental illnesses. Are we together?
Yes, sir.
Yes, the drugs are aimed at treating mental illnesses, whether they are psychosis, whether they are neuroses, depending on the ones that require medication or psychopharmacological treatment. It does not matter whether they are genetically caused or they are environmentally caused.
Okay, thank you.
Yes. So, any other question?
Sir, in addition, please, I think, hello, sir?
Yes, I'm with you.
Yes, sir. I just want to add to what you just said now.
Yeah.
Maybe if, just like you just talked about, if it is a sickness, is genetic. What I want to know is that can because that means as my have gotten it from the parents during the birth. It doesn't mean that if the person is treated now, he
cannot transmit it to his children.
Okay.
Hello? No, I'm only asking. I'm not just trying to have an insight.
Yes, that's the question I'm asking. If the person is maybe okay, this thing has been in this family for a very long time, and you see maybe somebody, maybe the first or second generation is somebody is developing that, and they say his grandfather used to have this, and then along the line he undergone the treatment. Does it mean that anyone that comes from his own loins or cannot contact that again? That is the question I asked.
Okay, when you bring forth offsprings, you also transfer genetically inherited traits onto them. Yeah, I can hear you. Are you hearing me? Hello?
Yes, I can hear you now.
Yes, sir. Yes,
I can hear you
sir.
Okay, when you bring forth offsprings, you transfer your traits onto the offsprings. For the fact that you have given birth to a boy and does not look like you, your genes are recessive. Once those genes are dominant, your traits become prominent. Are we together? So treatment of genetically inherited mental illness does not in any way stop you from transferring them onto your offspring. If they are recessive in that offspring, then that individual will not in any way come down with mental illness. If they are dominant, sure, he's going to come down with mental illness. Hello?
Okay.
Have I responded to your question?
Hello, sir.
Okay, sir.
Yes.
I'm listening, sir. Okay.
Okay,
sir.
I am saying that for the fact that your genetically inherited mental illness is treated with psychopharmacological drugs does not prevent you from transferring them onto your offspring. It depends on whether they are recessive or they are dominant. They are dominant in him. Have I responded to your question?
Yes, sir.
Sir,
yes.
Sir, I want to express a worry.
Yes.
As the lecture was going on, I was just worried. I say, there are so many beliefs and so many diabolic things that we believe in these days. And I was just seeing it as we were lecturing, I was just seeing how we have deviated from reality into unrealistic things.
Yes.
I don't know how we're going to handle that. In a family where the family don't even, you and your sister cannot even talk with one another again because you are feeling that your sister is bewitching you or something is happening that is not right. I don't know. We're talking about hallucination.
Yes, they are not actually hallucinations. They are cultural issues. Basically, you know that one cause of pathology, like I said, is the Nigerian context, the Nigerian context. And I deliberately left out religion out of it, the church out of it. You know, one promoter of psychopathology is the church, building up a culture of belief that someone is bewitching you. And I earlier on say that, okay, I've not mentioned this, but abnormal behaviors are learned. And for you to do away with them, you must also unlearn them. And what psychopathology what psychotherapy as a treatment approach does is to help you unlearn abnormal behaviors.
Okay.
Hello, sir.
Yes, I'm with you.
Good afternoon. Sir, I've listened to the discussion arising from the question the lady asked and your explanation. I come to understand, but I have a little worry.
Yes.
A child that is affected genetically, when the symptoms start to show, we go to the hospital where he can take drugs, and we believe that that may be healed or he will be cured of that ill health. Now the question is, does it mean that these drugs doesn't cure, they only subside? Because we are talking about heredity now, that the child, if I heard you very well, you say the child can also give birth to another child like that if his genes are dominant, except if he has a recessive genes. So the drugs, is it that they don't cure the illness completely? They only subdue them?
Psychosis is not curable.
Okay.
It's not curable.
And it can only be treated and managed. Symptoms can be relieved for you to have normal and optimal functioning in the society.
Okay.
Whether they are inherited or they are environmentally caused. Are we together?
Yes.
Yes, sir.
But
Okay.
I also have a
Yes,
question.
sir. Yes. Very clear.
Mine would just be a little of take back to the discussion on neurosis. And
yes,
here now when we are discussing neurosis, I do not know if my network affected me that I didn't hear very well the treatment method for different manifestations of those neurotic symptoms, and as a case may be. Are there some kind of treatment like we have them in a psychosis?
both treatment issues we have discussed are both for both for neurosis and also for psychosis. Are we together?
Yes, sir. Yes, sir.
Yes, sir.
Together, sir.
Yes. If there is no other question, I want to quickly introduce us to types of disorders, specific types of disorders, and I want us to quickly discuss personality disorders before we round up for the day. Are we there?
Yes, sir.
Yes,
Yes,
sir.
sir. Yes, sir. We are with you, sir.
More often than not, you say do you know my personality? Do you know my personality? So in a common understanding, my personality is who I am. Isn't it?
Yes.
Yes, sir.
My personality is who I am. Who are you? And who I am. Personality is very vital to defining who individuals are. And it has to do with a unique blend of traits that are peculiar to an individual. It has to do with our attitudes, our thoughts, our behavior, and the traits we have inherited from our parents. and how we are able to express these traits in our interaction with others and the world around us. Now, when we don't harness, when we don't coordinate, when we don't interact positively, then it becomes a problem. So a personality disorder sets in. Are we together?
Yes, sir. Yes, sir. We are together.
Are we together?
Yes, sir. We are with you.
Yes, we are.
We are with you, sir.
Are we there?
Yes, sir. We are here with you.
Okay. So your personality has to do with who you are. And it is what defines you as an individual. So it has to do with your attitudes, your thoughts, and your behavior, and how well you are able to express your thoughts, your behavior within your environment and with others. So when you cannot harness this properly, it becomes a disorder. Are we together?
Yes, sir.
Yes, sir.
Then we are talking about personality disorder. But before we understand what personality disorder is, remember that Allport defined personality as a dynamic organization within the individual thought and psychophysical system that determine his unique characteristic behavior and thought. Now, your traits, your attitudes, your thoughts are organized. They're organized, that is why you know when to be aggressive, you know when to calm down, you know when to laugh. And this resides within your physical system, your normal physiological body system, and your psychic, which has to do with your brain. And this determines how you behave and how you reason. Now, when the reasoning deviates from the normal, it becomes abnormal and a disorder. And then we begin to talk about personality disorders. Am I carrying everybody along?
Yes, sir.
Yes, sir.
So a personality disorder is a mental health condition. A mental health condition that long-lasting, all-encompassing, disruptive patterns of thinking and behavior, moods relating to others. A mental health condition that involves long-lasting. Underline the word long-lasting. It is all-encompassing because it affects every aspect of the individual. It is disruptive because it disrupts your thought process, it disrupts your behavior, it disrupts your thinking, it disrupts your relationship. And when there is this disruption, it results to significant distress, or it hinders or inhibits your ability to function properly. Is that understood?
Yes, sir.
Now, personality disorders may cause distorted perceptions. Perceptions have to do with how do I perceive? How do I look at things? How do I look at others? Am I looking at things in a realistic perspective, or I am looking at them in a distorted perspective? Am I looking at what is normal as abnormal? And it causes distress across various aspects of our lives, including our work, our relationship, our social functioning. Unfortunately, most people with personality disorders may not recognize their troubles, or that they have troubled behaviors, or their behaviors negatively affects them and also affects others. Is that understood?
Yes, sir.
Now, there are different types of personality disorders affecting individuals. DSM, the Diagnostic Statistical Manual of Mental Disorders, have brought forth 10 types of personality disorders and have classified them into clusters or categories or groups. Clusters here refers to groups or categorization of personality disorders. Types of personality disorders according to their clusters. Remember, we're looking at psychopathology. And for us to be able to understand psychopathology, we must be able to understand classes or clusters or types of psychopathology as they affect us, as they affect our social. Are we together?
Yes, sir.
Hello.
Hi. So we are here with you.
Are we together?
Yes, sir.
Yes, sir. Yes, sir. We're here.
Now, for personality
Yes, sir.
disorders, we have 10 personality disorders classified into 3 clusters. And each of the clusters has specific types of personality disorders. As we discuss them, you can also do an introspection about yourself to see whether you are suffering from one of these disorders or not. It will also enable you to understand that why this person behaved like this is because he was suffering from a personality disorder. And it can also help us to understand whether there are deviations in social standards that are set within the society. Are we on the same page?
Yes, sir.
Are we understanding?
Yes,
Yes,
sir.
sir.
Yes, sir. We are understanding.
Okay. So the first cluster or types we are going to look at are group of disorders that are found under what we call the cluster A according to the DSM publication. And these clusters of personality disorders involve unusual, eccentric thinking and behaviors. Unusual because the individual behaves in an unusual way. And the first one under this cluster is what we call paranoid personality disorder. Paranoid personality disorder. And the main feature of this condition is paranoia. And paranoia has to do with a relentless mistrust and suspicions of others without adequate reasons for suspicion. You are with your friends. All of a sudden, you start suspecting one of them that he wants to harm you. He wants to bewitch you. Now, while we're trying to round up classification of mental, a question came forth. Our sister said she's worried. She has concerns that she has noticed that there are some cultural issues that will make you, start feeling that not breathing with your sister suspect harm you. I guess we all listened to that question.
Yes, sir, we do.
Hello?
Yeah, we did. We heard the question.
People are not with me.
We are with you, sir.
With you,
We
sir.
are with
With
you.
you.
I'm with you, sir.
We are with you, sir.
Okay. So when she had raised that concern, it is very quick to say that such persons are suffering from paranoia because they are suspecting others to bewitch them, to harm them without adequate reasons for such suspicion. Now, such individuals suffers what we call paranoid personality disorder because there is a sudden, relentless mistrust and suspicion of close associates or close relations. So people with paranoid personality disorders often believe that others are trying to demean them, they are trying to harm them, they are threatening their existence. And one common feature you look at to qualify an individual to be diagnosed of paranoid personality disorder is the fact that there is paranoia. There is a relentless mistrust or suspicion on close relations, close friends, or close associates. Then we also have the second type called schizoid personality disorder. Schizoid has to do with a consistent pattern of detachment from general disinterest in interpersonal relationship. Individuals who develop this type of personality disorders detach themselves from general relationship. They have had relationship, but you will notice them withdrawing from such relationships. They stay away from such relationship. They have limited range of emotions when interacting with others. So when the group is happy, they are indifferent. When the group is talking about bereavement, they are indifferent. But these patterns are consistent. Not that somebody in a group is indifferent today and you say, oh, this person is suffering from schizoid personality disorder. The DSM classification gives us a minimum period of consistency of 3 to 6 months to qualify an individual to be diagnosed of schizoid personality disorder.
Sir,
are we together?
Yes, sir. I have a question there, sir.
Yes, sir.
Yes.
The place of individuals who are said to be maybe the place of temperament, maybe those who are introverts and all of that, who usually they withdraw from others and are quiet type of persons. How do you relate that to schizoid disorder, personality disorder?
Yes. People who are withdrawn in a group. If you look at our personality classifications, we have individuals who are extroverts. They are easy to form associations. They are easygoing. They build relationships quickly. You will notice that we have individuals who are conscientious. They are more careful. They are a little bit mean. It's a personality trait. Then you also look at individuals who are open to novel experiences. We have individuals who have agreeable personality traits. They are easygoing, they agree with new innovations. They also reason with your own side of reasoning. Now, individuals who are withdrawn from a group or who do not have interest in a particular group behavior does not qualify them to be diagnosed to suffer schizoid personality disorder simply because they are disinterested in a particular group activity. In every group, it is not every activity of the group that you are interested in. That does not qualify you for diagnosis. There is a consistency and a peculiar pattern of detachment. Has a duration for that consistency to happen to qualify you for this diagnosis. And it is a minimum of 3 months and maximum of 6 months. Then it qualifies you to be diagnosed of schizoid personality disorder.
Okay, let me just follow up again.
I've answered your question.
Yes, sir, you have, but I just want to have follow up again. Now, this schizoid personality, is it, can it be also hereditary or maybe a biological, or we develop it at some point in time? Let me give an example.
Yes.
One of my nieces, they are twins actually, and then the one of them is when you see him, you just know that this is an extrovert, but the other one is extremely quiet, and when you see people sit like this, he will just withdraw and go and sit at one far extreme, and he's just there alone. So, and he's just a boy of 3 years now. So
yes,
I have been thinking about it.
You are wanting to label him.
Yeah, at some point I want to label him. At some point I want to believe.
That's not a disorder. That's a trait.
Okay.
Traits are different from disorders. Okay. They are our inherited traits or our personality traits are made visible through our behavioral actions and inactions. So for him, he is an introvert. The other is an extrovert. And that does not in any way qualifies him for diagnosis of schizoid personality disorder. I don't know if I've responded to your question.
Very well, sir. Very well, sir.
Hello.
You have responded very well.
Yes,
okay, is that Sunan?
Yes, sir. Thank you, sir.
Okay, can we make progress?
Yes, sir. We can.
Okay. So the third classification under the cluster A is what is called schizotypal personality disorder. Schizotypal. You know, this classification is characterized by eclectic behavior. Now, bizarre, strange behaviors. Now, schizotypal personality disorder, people who are classified under this disorder display consistent. Always notice the consistency in the manifestation of their symptoms or behaviors. There is that word consistent in the pattern of intense discomfort with unlimited needs in their relationships. So their relationships may be hindered by their distorted view of reality. This kind of people hold onto superstitious beliefs and unusual behaviors. Now, for instance, there are some persons that have heard these superstitious beliefs and behave bizarrely. When they want to walk on the road, they will say, when they meet a woman on the road, as the first person, the journey is not palatable, going to be palatable. They're not going to reap the best out of this journey. Have you noticed this kind of people?
Yes, sir.
Yes. You will notice, yes.
Yes, sir.
You will notice the consistency in that pattern of behavior. It is because they have a distorted view of reality, but they have heard to these superstitions, and that has given rise to unusual behavioral displays or manifestations. Are we together? Are we on the same page?
Yes, sir.
Yes.
Hello.
Yes, sir. We are with you.
We're here,
Hello,
sir.
sir.
We're here.
We are with you.
Hello.
Hello, sir.
Hello, sir. We
We're
hear
here.
you.
We are with you.
We are with you,
We
sir.
are with you.
I'm
We
not
are with you,
sure.
sir.
I'm not sure you are with me.
Sir, we are with you.
With
We
you,
are
sir.
with you. We are with you.
About
We are
schizotypal
hearing you.
disorder.
Yes.
You were
What did
saying that it is the too much attachment to superstitious beliefs. That is what constitutes psychosis.
Yes, that's what constitutes schizotypal personality disorder. So the focus of our personality is on the fact that we have held onto superstition, and it has influenced us to behave in unusual way.
Yes.
So people who are diagnosed to be suffering from schizotypal personality disorders, you will notice a consistent pattern of intense discomfort, and there is limited needs in their relationship. Is that okay? For core relationships.
Yes, sir.
Yes, sir.
All this is because of the belief system they have upheld. And I was giving an example. There are some men who say that when they start a journey and they come face to face with a woman, they believe that they're going to have a bad outcome. There are some
another example,
who believe that if you pass by the right hand of by their right side, it's a bad omen. To them, they have held onto these beliefs, and you will notice them behaving unusually when they see people trying to pass on that particular side of the on that particular side of themselves, you know, believing that they are going to have a bad omen or a bad day, as the case may be. And it varies from culture to... Are we together?
Yes, sir. We're together.
Yes, we are together.
So I want to give an example.
Hello.
Yes, sir. I want to share a little example of experience.
Yes.
There is this woman that sells in the market, and the first person that will buy from her that money must be a little baby of 3 to 10 years. If you bring any amount for her to sell for you, she will not sell for you until she sells for a baby of 3 to 10 years. I think this is the type of belief we are talking about.
Yes. So that woman, you see her behaving in unusual way. Now, you will notice that she will have customers who really are big time buyers. But when they come, she will refuse to sell to them.
Yes.
So such individuals...
Example.
Yes, such individuals...
Hello, sir.
Yes.
Yeah, there's another example and experience that I also had. I used to have a neighbor, which was a woman too. She sells, and each time she's leaving her house to her set point, she will want a man, a male, to first meet with her. So sometimes she will even ask someone to come towards, I mean, in opposite direction to meet her before she goes to her set point. Yes.
Yes. So you are beginning to also notice that you have seen people exhibit these kind of disorders within your society. You are understanding now that these are actually disorders. They are not normal, they are abnormal way of behavior. Are we together? Thank you,
Yes,
Ralph.
sir.
So the second cluster that we're going to discuss briefly before we will close for today, it's types of personality disorders that fall under cluster B. And we said this type of behaviors this type of disorders involves dramatic and erratic behavior. People with this type of conditions displays intense and unstable emotions. They are impulsive. They're impulsive. Now, the first one is called the antisocial personality disorder. And some of these disorders may also be experienced by some of us. We'll also be carrying out introspection to see if truly we have also developed some of these personality disorders. Now, with the antisocial, people show lack of respect towards others. And they don't follow socially unacceptable norms or rules in the society. What social standards seeks to do is to bring us to an understanding that there are minimal standards that we operate within our society. You will notice that such people drive against traffic. You will also notice that people with antisocial personality disorders, they break the law. They are truants. They wouldn't mind causing emotional or physical harm to others around them. They don't mind. As far as it pleases them, they are okay. They refuse to take responsibility for their actions or inactions. And they display disregard for the negative consequences of their actions. Have we seen this kind of people around us?
Yes, sir.
Or are we also falling in this category?
We have seen them, and some of us are victims here.
So I think we have some here. Some of us, we are here.
That's all right. So you begin to see that when people break the law, when people are intentionally willing to cause harm to others, you begin to notice that it is not just normal, it is a personality disorder. And it is called the antisocial personality disorder. It is antisocial because it negates the principle of social relationships. Are we together?
Yes, sir.
Yes, sir.
And then we have, under this cluster, we have the borderline personality disorder. Borderline, you know that it is on the border of the line, isn't it?
Yes, sir.
So these people are at the border of their emotional regulations. They have difficulty regulating their emotions. So most often than not, their actions result to what we call low self-esteem, mood swings, impulsive behaviors, low self-value, low self-worth. When we began this class, at one point I had mentioned that you are among a group of social friends who graduated from the same class. And then amidst you, there is one who has not made it in life. So finding it very difficult to manage his emotions, you will notice that he will find it very difficult being in your gatherings. He feels, oh, I am the least amongst them. I'm not qualified to be here. Now, every little thing, if peradventure he is with a group, every little thing he flares up. It is because I have not made it in life. That's why you are treating me the way, you are talking to me that way. You know, this shows that there is something wrong with your personality.
Everybody will just tell me, say, I could just pat down and see, or you just leave and just say, well, I just around.
Abu Simon.
That's another disorder.
That's also another disorder, right?
Order from me.
It's okay. So could that be antisocial personality disorder?
I wasn't muted, but the noise wasn't coming from me.
Okay. So these kind of people find it very difficult to regulate their emotions. So they easily flare up. At the slightest provocation, they cannot control their emotions. And this results to low self-esteem. They have a low self-worth for themselves and what they can do. They react differently at different forums. We talk about mood swings. Somebody was asking whether an individual with bipolar 1 mood disorder is actually mood swing. So we're talking about mood swing now. there is one reaction here. You think they are actually sad before you know they are also behaving as if it's normal. When you think all it's well, they have returned to one emotional outburst or display or another. These behaviors are called impulsive behaviors. And these kind of people have difficulty in relationships. You know, even in our normal social relationships, we have people with borderline, people who suffer borderline personality disorders. They break away from relationships. They have justifications for their breakaway. They regret, they come back to make friends, and you see them, you know, reacting in the same pattern and way that actually have caused a break in this relationship. It affects both men and women at all times, depending. It affects both men and women at all times. Do we have a clear understanding of a borderline personality disorder?
Yes, sir.
Yes, sir.
And then we,
Yes, sir.
and then we have the histrionic personality disorder, which is marked by intense and unstable emotions and a distortion in self-image. You know what is self-image? How do I look like? How do people look at me? How do I appear before people? You know, that's self-image. So people with histrionic personality disorder ends with their self-image. Once they don't have a realistic understanding of perception of their self-image, their emotions become unstable. So for people with this personality disorder, their self-esteem is dependent on the approval of others and does not come from a true feeling of self-worth. So you will notice this kind of persons, if they speak in the public, they come back to do an assessment of themselves. And the questions they ask is, how did I perform? How did you see me perform? You know, what was my presentation? How was my presentation like? Now, if he receives an upload of people, he has a positive self-image about himself. And if people say, if people disapprove of it, he has a negative self-image of who he is. You know that such people, they have overwhelming desire to be noticed by others and may display dramatic or inappropriate behaviors just to get attention. So it's also possible to say that these are the notice me type of people who want to seek public attention, who also want to seek the approval of others. Am I carrying everybody along?
Yes, sir.
Yes,
Well,
sir. Sir, can we?
Yes.
Can we refer to this personality as a generalized order?
It is not generalized. It is not a generalized personality disorder.
It's okay, sir.
It has specific criterion for diagnosis. It is called histrionic because the individual has unstable emotions. Now, for one to be qualified to be diagnosed to suffer histrionic personality disorder, there must be instability in his emotions. He must also report a distortion of how he looks at himself. Now, when you give him, when you ask him to rate, or when you ask him to rate himself, he tells you it depends on how others look at me. Are we understanding?
Yes.
Because he's depending on the approval of others. And he's not depending on what he is convinced that he is. So for every of his behavioral manifestations, he wants people to look at, to notice him and pass a judgment of what he has done or who he is. I don't know whether that is clear.
Very clear, sir.
Very clear, sir.
It's clear, sir.
Hello?
Hi.
Hello, sir.
Is that clear?
We are with you, sir.
Yes, sir.
Yes, sir.
We are with you, sir.
Oh, okay, sir.
It's all right. So, the last on this cluster of personality disorders is what we call the narcissistic personality disorder. I think we will take this as the last on the cluster B classification, and we'll continue tomorrow on cluster C. Is that agreed?
Yes, sir.
Yes, sir.
Yes, sir. Yes, sir.
Yes, sir. We agree.
Okay, so the narcissistic personality disorder is a personality disorder that involves consistent pattern of perceived superiority and grandiosity. You remember when we were discussing a classification of psychosis or mental disorders, and we came to look at one of the characteristics of psychosis. We say that psychotic individuals suffer delusions. And one type of delusion we mentioned was delusion of grandiosity, feeling of superiority, feeling of being important when you are not, feeling that you are above others. Now, individuals who have narcissistic personality disorder oftenly they have this attitude of feeling important and above every other person within the group. You know, they easily feel disrespected. They easily feel that you are undermining their authority. And this kind of people have an excessive need to be praised and to be admired by others. And on the other end, they lack empathy for others. They don't show concern for others. They don't care about how others feel. All they are concerned with is how they feel. How they are concerned with it's the fact that they have been respected and they have been known to be superior. But you also know that these kind of thoughts have their roots from the fact that such individuals lack self-confidence and they don't have self-esteem. So they are looking for how to build their self-esteem. They are looking for how to build their self-worth. Are we together?
Yes, sir.
Yes, sir.
Yes, we are together.
Is there any question?
Yes, sir. I was going to ask because when you talk about any of the clusters, I start screening whether I'm part of one or people around me. Now, this the last one we are talking about, this
narcissistic
behavior. You discover that is it that our leaders at some point they don't show this kind of behaviors, particularly when they are seeking elections and all of that. And then immediately they get into power, you see them behaving in a particular manner that they show superiority, ask their security to beat. They don't have empathy. People are dying, and then they're not even paying, for instance, they're not even paying salaries. All they want is they should be singing them every day. Does this fall under this kind of order, or this one is something else?
Yes. When you do a comprehensive assessment of our politicians and our leaders, most of them suffer antisocial personality disorders. Most of them suffer narcissistic personality disorders. Some of them suffer histrionic personality disorders. And when you also generally do an assessment of the supporters, they also suffer these personality disorders. So it is not all about the leaders. It is not all about the political class. It's also about the supporters. It is also about the generality of the people. They suffer these personality disorders. But we don't encourage on-the-spot diagnosis, where you look at someone's behavior and you do an assessment. But you can also look at the presenting symptoms, and they can qualify such a person for such diagnosis.
It's understood, sir.
Is that understood?
Very clear, sir.
Yes, sir. It is.
Yes, sir.
Okay, do we have any other question before we call it a day for today?
No question, sir.
Is there no question because you want to go, or is
Hello,
because the
sir. Good
class is
afternoon,
clear?
sir. Hello, sir.
No, sir. We
Yes.
have even agreed
Hello,
that
sir.
we'll wait till 2:30, so it's fine,
Yes.
sir.
Pardon?
Hello, sir.
We had earlier
Yes.
agreed that the class will end by 2:30.
Okay, all right.
So
Yes.
you are still within
Yes,
time.
all right. Can I listen to your question? Jato?
Hello, sir.
Yes.
Yes, sir. How do you handle, or how do you manage a narcissist?
A narcissistic personality disorder.
Yeah, someone like maybe you are living with someone that has this attribute. How can you manage it? Like someone that probably is older than you. How do you manage
Yes.
it?
It is managed through
2:30. This will help
psychotherapeutic
us cover
approach.
for the lost time due to network.
There are no drugs
Oh,
that
understand that.
there are no
So, more when I
drugs
react,
that
go
take care
man,
of
if you need
narcissistic
where we
personality
are.
disorder.
Oh my very
But
blessed.
there are therapeutic approaches that take care of narcissistic personality disorder. We have what is called the cognitive behavioral therapeutic approach. And under the cognitive behavioral therapeutic approach, we have what is called thought restructuring. Thought restructuring as a technique of CBT. It is an effective technique. It's an effective technique in the treatment of narcissistic personality disorder. We also have what is called the dialectical behavioral therapy, the DBT. These therapeutic approaches are very effective in the treatment of narcissistic personality disorder. They are learned therapeutic. They are learned approaches. You know, they are specialized treatment approaches that that one can undergo the process of learning and also be able to apply them. You know, in our second semester, where we'll be looking at psychotherapy as a course, we'll be discussing in depth these psychotherapeutic approaches as forms of treatment for disorders. Have I answered you?
Yes, sir. Thank you, sir.
You're welcome. So let's quickly look at cluster C disorders as we have actually agreed that we'll stop by 2:30. So the cluster C personality disorders involve severe anxiety and fear. Individuals who are diagnosed with this type of personality disorders develop some form of anxiety. And under this this approach, we have the avoidant personality
disorder.
Avoidant personality disorder. And the avoidant personality disorder, persons who are diagnosed with this condition have chronic feelings of inadequacy and are highly sensitive to being negatively judged by others. You don't trust yourselves. You don't trust in your abilities. You quickly feel that people are judging what you have done, your actions or inactions negatively. Though they would like to, you would like to interact with others, but at the end, you know, you are afraid of forging on with these interactions due to an intense fear of being rejected by others. Such individuals have a high feeling of inadequacy. They don't trust their abilities. They don't trust their capabilities. They don't trust what they can do. When they want to sit for exam, they're not confident that they're going to write these exams and pass. So most students suffer this kind of disorders. They're afraid to meet their goals and all of that. Is that understood?
Yes, sir.
Yes, sir.
Is that understood?
Yes, sir.
Yes, sir.
Hello?
Yes, sir. It's
We
understood.
are here
Yes,
with
sir.
you,
We are
sir.
here with you.
Yes,
We're with you,
we
sir.
are.
Hello?
Hello, hi, sir. We are with you.
We are with you, sir.
Hello? Are we together?
Yes, sir.
Yes,
Yes,
sir.
We are
We are
together.
together, sir.
Together.
Yes, sir. Yes, sir.
Hello?
Hello, sir.
Hello.
Hello, sir.
So we can hear you. We are together.
We
Maybe
can
his
hear you
network is
clearly,
bad.
loud and clear.
Maybe it's a bad network from
Hello?
his end.
We can hear you, sir.
Are we together?
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir, we are, sir.
We can hear you loud and clear, sir.
Manasseh, are we together?
Very well, sir. We are together, sir. I can hear you loud and clear, sir.
It seems the
Apple, are
network
we together?
is from his.
Yes, I
So
think
we
it's
are
a,
together. We are
okay.
together.
Yes,
We
we
are
are
here. We are
together.
together,
Can
sir.
hear you very loud and clear, sir. Hello, sir.
He's been muted, so.
I think
Seems the network is
might be
from
the
his side.
network.
We can hear him, but he can't hear us.
So you can unmute.
Desmond, kindly unmute him. Let's see.
The network is from him here.
Okay.
He has been thrown out.
So at least we have covered more grounds now. So
Very well.
let's wait a bit, and then if it doesn't come, I think the class can still end. Okay, he's back.
Hello, class rep.
Sir?
Are we together?
Please.
Yes, sir.
Okay,
We
yes,
are
sir. Here,
together.
sir.
We are with you, sir. And we can hear you very loud, clear.
He's thrown out again by network.
Yeah,
Let's call it a day now. As far as you have covered many things.
In attendance. Please, I'm not taking the attendance.
Please, let's wait for him. Please, let's wait for him to come back. I think he's trying to come back.
Hello?
Hello, sir. We can hear you, sir.
Can you hear me?
Yes, we can
Yes,
hear
sir,
you
we can.
loud and clear.
We are with you, sir.
I can
We
hear
are
you
with
loud
you.
and clear.
Okay, we are saying that individuals with this personality disorder actually have a feeling of low self-worth. They are only looking for the acceptance of others. So they do not believe in their capacity. They do not believe in their abilities. So for every action carried out, they are watching and waiting for others to give approval to show that indeed they are accepted before they can have a feeling of self-worth. Are we together?
Yes, sir, we are together.
Yes, we are together.
So on that note, I want us to pause here for today.
Okay.
So that when we resume tomorrow, you also go and look at what we have discussed, where you have concerns or questions. We'll respond to them tomorrow when we'll do a recap of what we have done today. And then we'll continue tomorrow. We have tomorrow and we have Friday, where we will be rounding up our engagement. Tomorrow we'll be looking at, we'll do a continuation of the cluster C personality disorders. We'll look at how personality disorders are treated, and we'll also continue to look at other forms of disorder. If time will permit us, we'll look at sexual disorders, we'll look at childhood disorders, we'll look at emotional disorders as the network will permit us. And then by Friday, we'll be looking at the contributions of how social standards can contribute to our understanding and management of psychopathology. So if there is no other question, we can call it a day for now.
Thank you so much, sir. We are grateful.
Thank you, sir.
Thanks very much,
Thank
sir.
you, sir.
Wonderful
Thank
lecture.
you. Thank you and have a lovely day.
Shimakas. Have a blessed day.
Thank you,
Raffo.
sir. Thank you.
Yeah.
Thank
We
you.
enjoy the
Great
lecture.
job. Wonderful presentation, sir.
Thank you, sir.
Thank you.
Thank you,
Thank you.
sir.
Thank you. Thank you.
How is she here over there? I really do, yeah.
Pardon? No, it's a lecture.
And that's a Kamala do it. I have to go.
Who is drinking Kamu in the class now?
So drinking in my office or not in the class?
There are no announcements, please.
The Kamu not on the table, please.
Class rep.
Sir?
You guys should come and join me.
Who is calling class rep?
It's the person that's drinking Kamu.
Jesus.
Pass it through the network.
Desmond, please, can you end
Please,
this?
can we end the class?
All right.